Have you noticed something about your cat recently that you cannot quite explain? Not something dramatic. Not something that sent you rushing to the phone to call the veterinarian. Something quieter than that. Something that crept in so slowly and so gradually that you almost talked yourself out of noticing it at all. Your cat is eating. Every meal. Sometimes more enthusiastically than before. The bowl gets cleaned. The food disappears. From the outside, from the feeding routine, everything looks completely normal. But something is different. You picked them up last week, the way you have picked them up 1,000 times, and your hands told you something before your brain had time to form the thought. They felt lighter. Not dramatically. Not shockingly. But unmistakably lighter than they used to feel in your arms. And when you looked more carefully, when you ran your hands slowly along their sides the way you do when you are really paying attention, you could feel something you could not feel before. The ridge of the spine. The individual bumps of the vertebrae. The ribs closer to the surface than they should be. And your cat looked up at you from your arms with those completely calm, completely trusting eyes. Still purring. Still themselves in every way that shows on the surface. No distress. No obvious suffering. No signal that anything is wrong. Except the weight. Gone quietly. From a body that is still eating. You searched for answers and found the standard list. Maybe they are just aging. Maybe the food changed. Maybe they are more active lately. Maybe you are imagining it. And you almost accepted one of those answers because the alternatives felt too frightening to look at directly. But here is the truth that you already knew before you found this video. A cat that eats normally and loses weight anyway is a cat whose body is telling you something important. Not something you should accept. Not something that resolves on its own. Something specific. Something with a name. Something that, found early enough, can be managed, treated, and in many cases significantly reversed. The weight that is leaving your cat's body while the food bowl empties every day is one of the most urgent silent signals in all of feline medicine. And tonight you are going to understand exactly what it means. Hello everyone. I am Dr. Claire Donovan, and welcome back to Paw Secrets Lab. I have spent over 15 years in feline internal medicine with a specific focus on metabolic and endocrine disease in cats. And I want to tell you something clearly and directly from the very first minute of this video. Weight loss in a cat that is eating normally is never a benign finding. It is never aging. It is never just what happens. It is always a sign that something specific is happening inside that cat's body that is either preventing normal nutrient absorption, accelerating metabolic consumption beyond what the food intake can replace, or both simultaneously. The tragedy I see most consistently in clinical practice is this. By the time most owners bring a cat in for weight loss, the weight loss has been happening for 3, 4, sometimes 6 months. They noticed it early. Their hands told them in the first weeks. But the cat seemed fine otherwise. Still eating. Still purring. Still themselves. And the combination of normal outward behavior with the frightening alternatives made waiting feel like the safer choice. Waiting is not the safer choice. In every condition that produces weight loss in a cat eating normally, early identification and early intervention produce dramatically better outcomes than late diagnosis. What if I told you that there are 5 specific hidden conditions responsible for the vast majority of cases where cats lose weight despite normal food intake? And what if each of those 5 conditions has a precise set of early accompanying signals that you can observe at home tonight? Signals that tell you not just that something is wrong but specifically what is wrong and how urgently it needs professional attention. Today at Paw Secrets Lab, we are going to cover this completely. Here is exactly what we are covering. In Chapter 1, I am going to explain the weight loss paradox biology. You are going to understand exactly how a cat's body can be eating normally and losing weight simultaneously, and what biological mechanisms make this possible. In Chapter 2, I am going to reveal the 5 hidden conditions. These are the 5 most common specific causes of weight loss in cats with normal appetites, each with its own distinguishing signals and its own urgency level. In Chapter 3, I am going to teach you the home weight and signal assessment. This is the specific protocol for measuring your cat's weight accurately at home and identifying the accompanying signals that point toward each of the 5 conditions. And in Chapter 4 I will give you the critical warning signs that tell you this situation has already progressed to a point requiring same-day veterinary intervention. Subscribe to Paw Secrets Lab right now and join our extraordinary, growing community of educated, devoted cat parents. Get something to write with. What you learned tonight could change the outcome for your cat in ways that are measured in years. Let us begin. Welcome to Chapter 1. The Weight Loss Paradox Biology. To understand how a cat can eat normally and still lose weight, we need to understand the complete journey that food takes from the bowl to the body. Because weight maintenance is not simply about how much food goes in. It is about what the body does with that food after it arrives. And there are multiple points in that journey where things can go profoundly wrong without producing any visible change in appetite whatsoever. When your cat eats a meal, the food enters the stomach where mechanical digestion begins and acid begins the process of breaking down proteins. The partially digested material then moves into the small intestine, which is where the majority of nutrient absorption occurs. The walls of the small intestine are lined with microscopic finger-like projections called villi that dramatically increase the surface area available for absorbing nutrients from the digested food. These nutrients, proteins, fats, carbohydrates, vitamins, minerals, cross the intestinal wall and enter the bloodstream. From the bloodstream they are transported to the cells throughout the body that use them for energy, for tissue maintenance, for organ function, and for everything else the body requires to sustain itself. Weight maintenance requires that this entire journey functions at adequate efficiency. Food in. Nutrients extracted. Nutrients delivered. Cells sustained. Now here is where the paradox becomes biologically possible. Disruption at any point in this journey can produce weight loss without any reduction in appetite or food intake. If the stomach fails to properly initiate digestion, the food moves into the small intestine in a form that cannot be efficiently absorbed. If the small intestine lining is inflamed, damaged, or infiltrated by abnormal cells, the villi are compromised and nutrient absorption is dramatically reduced even when the food itself is completely normal. If the nutrients are absorbed but a metabolic condition is accelerating their consumption far beyond the body's maintenance requirements, the cells receive nutrients but burn through them faster than the food intake can replace. In each of these scenarios, your cat's appetite may be completely normal or even increased, because the hunger signaling systems are separate from the digestive and metabolic systems producing the problem. Your cat feels hungry. They eat. The bowl empties. But somewhere between the bowl and the body's cells, the nutrition is being lost, blocked, or burned away. This is why appetite is not a reliable indicator of nutritional status in cats. A cat eating enthusiastically is not necessarily a cat whose body is receiving adequate nutrition from what they eat. And there is one more layer to this biology that makes it particularly urgent in cats specifically. Cats are obligate carnivores with a metabolic architecture that is deeply intolerant of caloric deficit. Unlike dogs or humans, cats cannot efficiently shift their metabolism to use fat stores as a primary energy source when protein intake is insufficient. When a cat's cells are not receiving adequate protein and calories, regardless of the reason, the body begins breaking down muscle tissue to meet energy needs. This is called muscle catabolism, and it is irreversible beyond a certain threshold. Muscle that is broken down for fuel in a nutritionally compromised cat is not rebuilt when the underlying condition is treated. It is gone. The weight you feel disappearing from your cat's body is not just fat. In many cases, it is muscle. And the urgency of finding and treating the underlying cause is therefore not just about correcting the number on the scale. It is about preserving tissue that cannot be replaced once it is lost. Welcome to Chapter 2. What is actually causing the weight loss? I am going to walk you through each of the 5 hidden conditions that most commonly produce weight loss in cats with normal or increased appetites. For each condition, I will give you the specific accompanying signals that distinguish it from the others so that your home assessment in Chapter 3 can be targeted and precise. Hidden condition number 1. Hyperthyroidism. Hyperthyroidism is the most common endocrine disorder in cats, and the most common cause of weight loss with maintained or increased appetite in cats over 8 years of age. The thyroid gland, located in the neck, produces excess thyroid hormone due to a benign enlargement of thyroid tissue called an adenoma. This excess hormone accelerates virtually every metabolic process in the body. The heart beats faster. The gut moves faster. Calories are burned at a dramatically elevated rate. And no matter how much the cat eats, the metabolic furnace consuming those calories is running at a rate that food intake cannot keep pace with. The distinguishing signals of hyperthyroidism alongside weight loss are these: increased appetite that is dramatic and sometimes frantic. Your cat may be eating more than you have ever seen them eat while simultaneously becoming visibly thinner. Increased thirst and urination. Hyperactivity or restlessness that is new and age inappropriate, a 10-year-old cat suddenly behaving with the energy of a 2-year-old. Increased vocalization, particularly at night, a new yowling or calling behavior that has no obvious trigger. A heart rate that is elevated and sometimes audible as a heart murmur. And a coat that has become unkempt because the cat is too metabolically activated to groom properly despite having the physical ability to do so. Hyperthyroidism is among the most treatable conditions in feline medicine. Medication, radioactive iodine therapy, or surgical removal of the affected thyroid tissue can restore normal thyroid function with excellent outcomes. But it requires diagnosis. And diagnosis requires a blood test measuring thyroid hormone levels that your veterinarian can perform in a single appointment. Hidden condition number 2. Inflammatory bowel disease. Inflammatory bowel disease, or IBD, is a chronic condition involving persistent immune-mediated inflammation of the gastrointestinal tract lining. In cats with IBD, the villi of the small intestine are damaged and flattened by the inflammatory process. Nutrient absorption is severely compromised. The cat eats. The food is digested to a degree. But the compromised intestinal surface cannot extract adequate nutrition from the digested material. The nutrients pass through and are lost rather than being absorbed into the bloodstream. The distinguishing signals of IBD as the cause of weight loss are these: intermittent vomiting that is chronic and low-grade rather than acute and dramatic. Not daily necessarily, but consistently recurring over weeks and months. Intermittent diarrhea or loose stool that alternates with normal stool consistency. A coat that has lost condition, appearing dull, less dense, slightly matted in places, because the nutritional deficiencies produced by malabsorption affect coat quality directly. Occasional episodes of reduced appetite that alternate with normal appetite. And a cat whose abdomen, when gently palpated, may feel slightly thickened in the intestinal loops if the condition has been present for an extended period. IBD requires a definitive diagnosis through intestinal biopsy to distinguish it from intestinal lymphoma, which is a malignant condition that can look identical on clinical presentation and even on ultrasound. This distinction matters critically because the treatment approaches differ significantly. Do not allow IBD to be managed empirically without a definitive diagnosis if the response to initial treatment is incomplete. Hidden condition number 3. Intestinal lymphoma. Small cell lymphoma of the gastrointestinal tract is the most common form of cancer in cats, and is one of the most frequently missed diagnoses in feline medicine because its early presentation is so gentle and so gradual that it mimics IBD almost perfectly. The small cell variant of feline intestinal lymphoma is a low-grade, slow-moving malignancy that infiltrates the intestinal lining with abnormal lymphocytes that progressively replace the normal absorptive villi. The clinical result is progressive malabsorption that produces exactly the picture you may be seeing in your cat right now. Normal or near-normal appetite. Gradual, persistent weight loss. Intermittent vomiting. Coat changes. The distinguishing characteristic that separates intestinal lymphoma from IBD in clinical terms is the response to treatment. IBD typically responds to corticosteroid therapy within 2 to 4 weeks with measurable weight stabilization and improvement in clinical signs. Lymphoma responds differently and requires a specific chemotherapy protocol that, in the small cell form, is remarkably well tolerated by cats and associated with median survival times that many owners are surprised and relieved to learn. Many cats with small cell lymphoma treated appropriately live comfortably for 2 or more years after diagnosis. The critical message here is that the distinction between IBD and intestinal lymphoma can only be made through tissue biopsy. If your cat has been treated for presumed IBD without a definitive biopsy diagnosis and is not responding adequately, please advocate for the diagnostic step that provides certainty. Hidden condition number 4. Diabetes mellitus. Feline diabetes mellitus produces weight loss through a mechanism that is the direct opposite of simple malnutrition. In diabetic cats, the pancreas fails to produce adequate insulin, or the body's cells fail to respond to insulin appropriately. Insulin is the biological key that allows glucose, the primary cellular fuel derived from carbohydrates, to enter the body's cells. Without adequate insulin function, Glucose circulates in the bloodstream at elevated concentrations but cannot enter the cells that need it. The cells are starving despite being surrounded by fuel they cannot access. In response to cellular starvation, the body initiates the breakdown of fat and muscle tissue to provide alternative fuel sources. The cat loses weight from tissue breakdown while simultaneously being unable to use the primary fuel source in their blood. And because the cells remain fuel deprived regardless of how much the cat eats, appetite remains strong or increases. The distinguishing signals of diabetes alongside weight loss are these, and they are highly specific. Dramatically increased water consumption. Your cat may be drinking from sources they never used before: faucets, glasses, any available water source. Dramatically increased urination, producing large clumps in the litter box that were not present before. Weakness or instability in the hind legs, a condition called diabetic neuropathy, where the cat walks with their hocks touching or nearly touching the ground rather than walking up on their toes as cats normally do. And a sweet or fruity odor to the breath from the ketone compounds produced during abnormal fat metabolism. Diabetes in cats is a manageable condition with insulin therapy and dietary modification. Remarkably, some cats achieve diabetic remission with appropriate treatment, meaning their pancreatic function recovers sufficiently to maintain normal blood glucose without continued insulin therapy. But this outcome is most achievable when diagnosis and treatment begin early. Hidden condition number 5. Chronic pancreatitis. The pancreas serves two critical functions. It produces insulin for blood glucose regulation, and it produces digestive enzymes that are essential for breaking down fat, protein, and carbohydrates in the small intestine. In cats with chronic pancreatitis, ongoing inflammation of the pancreas progressively impairs both functions simultaneously. When pancreatic enzyme production is reduced, a condition called exocrine pancreatic insufficiency develops. The small intestine receives food but lacks the enzymatic tools to break it down adequately. Nutrients pass through largely unabsorbed. The cat loses weight despite eating because the digestive system is receiving food without the means to extract nutrition from it. The distinguishing signals of chronic pancreatitis and associated exocrine pancreatic insufficiency are these: large volume, pale, greasy, foul-smelling stools that represent unabsorbed fat passing through the digestive tract. A dramatically increased appetite that is almost ravenous in character. Weight loss that is rapid relative to the other conditions on this list. Increased borborygmy, which is the medical term for audible intestinal sounds, loud gurgling or rumbling from the abdomen that you can hear from across the room. And occasional abdominal pain responses, a cat that flinches, hunches, or vocalizes when the abdomen is touched. Welcome to Chapter 3. The Home Weight and Signal Assessment. Armed with the 5 hidden conditions and their distinguishing signals, I am going to give you a precise at-home assessment protocol that tells you 2 critical things: how much weight your cat has actually lost, and which of the 5 conditions the accompanying signals most closely point toward. Assessment Step 1. The accurate home weight measurement. Do not try to estimate your cat's weight by feel. Estimation is what allowed this weight loss to go unrecognized for weeks or months. You need a number. Here is how to weigh your cat accurately at home without a veterinary scale. Step onto your bathroom scale alone and note your weight precisely. Then pick up your cat, hold them securely against your body, and step back onto the scale. Note the combined weight. Subtract your weight from the combined weight. The difference is your cat's current weight. Do this today and record the number with today's date. Then weigh your cat every 7 days and record each measurement. A weight loss of more than 1% of body weight per week sustained over multiple weeks is clinically significant and warrants a veterinary appointment this week. A weight loss of more than 10% of the cat's previous body weight at any point is a veterinary appointment this week regardless of how the cat appears outwardly. If you have previous veterinary records showing your cat's weight at past appointments, calculate the percentage difference between those recorded weights and today's measurement. Many owners discover when they do this calculation that what felt like gradual change represents a 15 or 20% reduction in body weight over 6 months. That number, seen clearly for the first time, is one of the most powerful motivators for the veterinary appointment that needs to happen. Assessment Step 2. The Body Condition Score. Veterinarians use a standardized body condition score from 1 to 9 to assess a cat's weight status beyond what the scale provides. Here is how to apply a simplified version at home. With your cat standing, place both hands on their sides and apply gentle pressure with your palms. In a cat at ideal weight, you should be able to feel the ribs with gentle pressure but not see them and not feel them without pressing. If you can feel the ribs without any pressure, your cat is underweight. If the ribs are visually prominent, and the spine is raised as a visible ridge, your cat is significantly underweight, and this finding combined with weight loss despite normal eating is a same-week veterinary appointment. Also assess the area above the tail base by feeling for the hip bones and the top of the pelvis. In a cat at ideal weight, these structures are palpable with light pressure but not visually prominent. Visually prominent hip bones alongside rib prominence indicate significant loss of body condition that has been progressing for an extended period. Assessment Step 3. The Signal Checklist. Work through the following specific observations and record which signals are present in your cat alongside the weight loss. Is your cat eating more than their usual amount? Dramatically increased appetite with weight loss points toward hyperthyroidism or diabetes. Is your cat drinking more water than before? Increased thirst alongside weight loss points toward hyperthyroidism, diabetes, or chronic kidney disease. Is your cat vomiting intermittently over weeks or months? Chronic intermittent vomiting alongside weight loss points toward IBD or intestinal lymphoma. Is your cat's stool large, pale, greasy, or unusually foul-smelling? These stool characteristics alongside weight loss point toward exocrine pancreatic insufficiency from chronic pancreatitis. Is your cat's hind leg gait abnormal, walking lower on the hocks than usual? This specific gait change alongside weight loss and increased thirst points toward diabetic neuropathy requiring urgent assessment. Is your cat more hyperactive, vocal, or restless than before? Behavioral activation alongside weight loss points toward hyperthyroidism. Is your cat's coat noticeably less well-maintained than before? Coat deterioration alongside weight loss accompanies IBD, lymphoma, and any condition producing chronic nutritional deficiency. Record every signal that is present. Multiple signals pointing toward the same condition significantly increase the probability of that diagnosis and strengthen the clinical picture you present to your veterinarian. Assessment Step 4. The Appetite Characterization. Characterize your cat's appetite specifically beyond simply noting that they are eating. Is the appetite normal, the same as it has always been? Increased, eating more or faster or more urgently than before? Ravenous, almost frantic in their food seeking? Or variable, sometimes normal and sometimes reduced? Each characterization pattern maps differently to the 5 conditions and provides additional diagnostic information. Assessment Step 5. The Photograph and Documentation Record. Photograph your cat from above and from both sides today, in good lighting, with their coat lying naturally. These photographs provide a visual body condition baseline that is impossible to retain accurately in memory alone, and that will be diagnostically useful at your veterinary appointment. Create a written record of today's weight measurement, body condition score observations, signal checklist results, and appetite characterization. Date the document. This is the clinical picture you bring to your veterinarian. It transforms your appointment from, "I think my cat might be losing weight," into a precise, documented, multi-week observational record that enables targeted diagnostic decisions. Welcome to Chapter 4. When weight loss requires same-day veterinary care. The home assessment protocol gives you the information to make an informed, appropriately urgent veterinary appointment. But there are specific presentations alongside weight loss that eliminate the need for home observation and require you to contact your veterinarian or an emergency clinic today without waiting. If your cat has stopped eating entirely for more than 24 hours in addition to the pre-existing weight loss, this combination is a critical emergency in cats. A nutritionally compromised cat that stops eating is at immediate risk of hepatic lipidosis, which is a life-threatening liver condition that develops within 48 to 72 hours of complete food refusal in a cat that is already in a nutritionally depleted state. Do not wait for a scheduled appointment. Call your veterinarian today. If your cat is showing the hind leg weakness of diabetic neuropathy alongside increased thirst and large litter box clumps, particularly if the weakness is new and progressing rapidly, same-day assessment allows blood glucose measurement and the initiation of insulin therapy before the metabolic crisis deepens. If your cat's breathing is labored, if you can see their sides moving visibly with breathing effort at rest, or if their respiratory rate is above 30 breaths per minute at rest, weight loss combined with respiratory difficulty can indicate that the underlying condition has produced fluid accumulation around the lungs, a condition called pleural effusion that requires immediate drainage and is a veterinary emergency. If your cat's gums are pale, white, yellow, or gray rather than normal pink, the color change combined with weight loss indicates either severe anemia from chronic disease or jaundice from liver involvement. Both require immediate veterinary assessment today. If your cat has become completely withdrawn, is not responding to your approach, is not using the litter box, and is spending all time hidden in an enclosed space, the combination of complete withdrawal with established weight loss indicates a cat in a critical state of systemic failure. Go directly to a veterinary emergency clinic immediately. And if you calculated a weight loss of more than 15% of your cat's previous body weight from veterinary records, that number alone, regardless of how the cat appears today, warrants a same-week veterinary appointment as a minimum urgency level. 15% weight loss in any mammal is a medical finding that requires investigation. You came here tonight because your hands told you something. Not your eyes, not a number on a scale, not an obvious symptom. Your hands. The hands that have held this cat 1,000 times. The hands that know the specific weight and warmth of their body the way you know almost nothing else in your life. Your hands noticed what your eyes were willing to overlook. What the part of your mind that does not want to worry was willing to dismiss. What every comfortable explanation was designed to make you accept without acting on. And instead of accepting it, you are here. Your cat is eating. The bowl empties. From the outside, from the routine, everything appears normal. And yet somewhere between the bowl and their body, something is consuming what they eat before it can sustain them. Their thyroid is accelerating their metabolism beyond what food can replace. Or the lining of their intestine is too inflamed to absorb what passes through it. Or abnormal cells are quietly infiltrating the tissue that should be feeding them. Or insulin is failing to deliver glucose to the cells that need it. Or enzymes are missing from the digestive process that would allow nutrition to be extracted from the food that arrives. Each of those possibilities has a name. Each has a test that identifies it. Each has a treatment that addresses it. And every single one of them responds better to early discovery than to late discovery. Every single week that passes between the moment your hands first noticed and the moment your veterinarian first measures and tests is a week of muscle your cat cannot get back, a week of a condition establishing itself more deeply, a week of a treatment window narrowing. You noticed early. That matters enormously. You are here now. That matters even more. The scale measurement you take tonight. The body condition score you assess with your palms on their ribs. The signal checklist you complete methodically and honestly. The documented photograph and written record you bring to your veterinary appointment. These are not small things. These are the actions that transform a vague worry into a clinical picture. That transform. I think something might be wrong. Into. Here is what I have observed, here is when I first noticed, here is what has changed, here is what I need you to help me investigate. That level of advocacy is what your cat cannot do for themselves. They cannot tell you their gut lining is compromised. They cannot describe the relentless hunger of a metabolism running at double speed. They cannot explain that the fuel their cells need is circulating in their blood but cannot get through the door. They can only be themselves. Eating. Purring. Looking up at you with those calm, trusting eyes while their body quietly, invisibly, urgently signals for help. You heard the signal. Your hands heard it first, and the rest of you caught up. That is what loving a cat looks like at the moments that matter most. Tell me in the comments below. Which of the 5 hidden conditions do you think might be affecting your cat? What signals are you observing alongside the weight loss? Tell me specifically and I will give you the most targeted guidance I can in my reply. And your observation might be the exact piece of information that helps another cat owner recognize the same pattern in their own home tonight. If this masterclass gave you clarity where there was confusion, urgency where there was hesitation, and a specific path forward where there was only quiet worry, please tap the like button. It tells the YouTube algorithm that feline metabolic health education matters deeply and carries this video to the cat owners whose hands are already telling them something they have not yet acted on. Subscribe to Paw Secrets Lab and join our incredible, compassionate, growing community of educated cat parents who refuse to accept incomplete answers about the animals they love. I am Dr. Claire Donovan. Weigh your cat tonight. Feel those ribs with honest hands. Complete that signal checklist. Write it down with today's date. And call your veterinarian tomorrow morning with the most complete, specific, documented picture of what you have observed. Your cat's body has been sending this signal for a while. Tonight you finally know how to read it. Now act on it. I will see you in the very next video.